Welcome back, all of you, to nursing officer exams for various central government exams like RRB, ESIC, AIMS, CHIPMAR, UPSC, etc. This is the mock test explanation series part 36. First question. Kaposis sarcoma is seen in option 1 measles, option 2 AIDS, option 3 glioma, and option 4 is glaucoma. The right answer here is option 2 AIDS. Kaposi sarcoma case is a cancer that forms in the lining of blood and lymph vessels. It is characterized by the development of purple, red, or brown lesions on the skin and mucous membranes. It is primarily seen in individuals with weakened immune systems, most notably those with HIV/AIDS. Next question. Who is the father of psychoanalytical theory? Option 1 Lawrence Koch-Lebel, option 2 Jean Piaget, option 3 Abraham Maslow, and option 4 is Sigmund Freud. The right answer here is option 4. Sigmund Freud is the father of psychoanalytical theory. He has explained the ED, superego, ego, and psychosexual development of children, etc. Senseless repetition of same words, phrases over and over again is known as option 1 stereotyping, option 2 trance, option 3 verbigeration, and option 4 is broadcasting. Right answer here is option 3 verbigeration. Verbigeration is a senseless repetition of same words or phrases repeatedly. These are disorders of verbal behaviors or speech. Next question. Which of the following is used for passive immunization? Option 1 killed vaccine, option 2 human animal sera, option 3 toxoid, option 4 live attenuated vaccine. The right answer here is option 2 human and animal sera. Passive immunization is achieved through the administration of performed antibodies, usually in the form of immunoglobulins, which can be given as a serum injection. So human and animal sera is used for passive immunity, and vaccines, toxoids, etc. will be used for active immunity. Next, the observable tip of the iceberg of disease represents option 1 clinically recognizable cases, option 2 unknown cases, option 3 hidden cases, and option 4 preventive cases. The right answer is option 1 clinically recognizable cases. We can see the figure. The yellow portion is the tip of the iceberg and the blue portion is the major portion which is not visible. So this is the unknown cases or invisible cases or hidden cases. Our clinically recognizable cases are the tip, which is mentioned as yellow color in this figure. Next question. In a lecture on sexual functioning, a nurse will include the fact that ovulation occurs when the option 1 endometrial wall is sloughed off, option 2 blood level of LH is too high, option 3 oxytocin level is too high, option 4 progesterone level is high. The right answer is option 2 blood level of LH is too high. Ovulation is triggered by a surge in luteinizing hormone LH. Next question. Koplik spots can be observed in option 1 oral mucosa, option 2 neck, option 3 chest and abdomen, option 4 skin. The right answer is option 1 oral mucosa. Koplik spots, which is seen in measles, will be observed in oral mucosa of the affected person. Next question. Management of Wernicke's disease and beriberi involves administration of option 1 iodine, option 2 vitamin A, option 3 vitamin C, and option 4 thiamine. Let us see the right answer. The right answer is option 4 thiamine. Vitamin B1 deficiency or thiamine deficiency will cause beriberi and Wernicke's syndrome. Risk of thiamine deficiency include excessive loss like hemodialysis and diuretics, then lack of intake or alcoholism. Next question. What is the stage of a tumor if it is of any size with positive or negative lymph node involvement and distant metastasis according to TNM classification. Option 1 stage 1, option 2 stage 3, option 3 stage 2, option 4 stage 4. Right answer is option 4 stage 4. We can see the different stages of tumors. Stage 0, cancer cell found in their earliest form. Stage 1, small tumor that has not spread. Stage 2, cancer has growth more deeply into nearby tissue. Stage 3, it is spread to lymph nodes of nearby tissues. And in the stage 4 or final stage, cancer that has spread to the distant part. The distant is the pure distant part of the body, that is the distant metastasis. So this is stage 4. Next question. Twitching of facial muscles when the facial nerve is tapped anterior to the earlobe is called option 1 Chevstov sign, option 2 Strasser sign, option 3 Homan sign, and option 4 is Brodsky sign. Right answer here is option 1 Chevstov sign. We can see the two sides, Strasser sign and Chevstov sign. These both sides are indicating hypocalcemia. Strasser sign is the sign which is related to the BT cuff on hand, and Chevstov sign you can see here, it is related to the facial muscle, twitching of facial muscle when the facial nerve is tapped. So option 1 Chevstov sign is the right answer. Next question. An educational activity organized by the employer for the employees to assist them in learning and skill improvement. Option 1 induction training, option 2 training program, option 3 in-service education, and option 4 career development. The right answer is option 3 in-service education is the activity organized by the employer for the employee to assist in learning and skill improvement. Induction training is the orientation program. Next question. Do no harm is which ethical principle? Option 1 veracity, option 2 beneficence, option 3 non-maleficence, and option 4 justice. Right answer is option 3 non-maleficence. Non-maleficence is most referred to as no harm principle or do no harm. Next question. An ongoing counseling process throughout an individual's lifespan is known as option 1 preventive counseling, option 2 developmental counseling, option 3 crisis counseling, and option 4 facilitative counseling. The right answer here is option 2 developmental counseling. Preventive counseling is some kind of counseling which occur before escalating any problems. Option 2 developmental counseling is an ongoing counseling process throughout an individual's lifespan, which is known as the developmental counseling. Crisis counseling, this is done to cope with the traumatic event. For example, after the death or departure of a beloved one. So to cope with such traumatic situations, crisis counseling is done. Stressful or traumatic situations. Then facilitative counseling is to develop self-awareness and work towards positive change. Next question. Parrot-like repetition of words spoken by another person is known as option 1 dyscalculia, option 2 neologism, option 3 echopraxia, and option 4 echolalia. The right answer is option 4 echolalia. Let us see the other terms. Dyscalculia is the difficulty to calculate or difficulty with the numbers or mathematics. Neologism is the coining of new words. Echopraxia is repetitive movements, and echolalia is repetitive words or parrot-like repetition of words. Next question. Out of the following, which comfort device prevents the external rotation of the hips of a bedridden patient? Option 1 trochanter rolls, option 2 hand roll, option 3 trapeze roll, and option 4 sandbags. Let us see the right answer. The right answer is option 1 trochanter rolls. You can see the figure. The trochanter rolls will prevent the legs from turning outwards. That is the external rotation. So this comfort device will prevent external rotation of the hip for a bedridden patients. Next question. How should a nurse assess whether a patient with cirrhosis has asterixis? Option 1, ask the patient to extend the arm. Option 2, instruct the patient to lean forward. Option 3, dorsiflex the patient's foot. And option 4, measure the abdominal girth. The right answer is option 1, ask the patient to extend the arm. You can see the figure here. When you are asking the patient to extend the arm, if the patient is having asterixis, it is the flapping figure. You can see the finger flap or shivering of the hands. You can see. So this is a sign of liver diseases, cirrhosis. Next question. A methodology for tracking the energy vector of interpersonal relationship in a group is known as option 1, group dynamics, option 2, sociometry, option 3, human relations, and option 4, leadership training. Right answer here is option 2, sociometry. The methodology of tracking energy vectors of interpersonal relationship in a group is known as sociometry. Next question. If a chest drainage system line is broken or interrupted, the nurse's first course of action should be option 1, document finding, option 2, notify the physician, option 3, check the patient's vitals, and option 4, clamp the tube immediately. This is the criteria kind of questions with priorities. So you have to see which is the first priority action. The right answer here is first priority is option 4, clamp the tube immediately. If a chest drainage system or line is broken or interrupted, the nurse's immediate action should be to clamp the chest tube immediately. Then the second one is notify the physician. Then check the vitals and document it. So this is the order. Clamp the chest tube, notify the physician, then check the vitals and document. Next question. A kind of play which can be observed in infant is option 1, associative play, option 2, parallel play, option 3, onlooker play, and option 4, unoccupied play. Right answer here is option 4, unoccupied play. Here you can see associative play is seen in infants and toddler with 3 to 4 years of age or preschooler. Sorry. Associative play is seen in 3 to 4 years, which is in preschoolers. Then parallel play is seen in toddlers 2 to 3 years. Onlooker play is in toddler or young children, and unoccupied play is seen in infant. Unoccupied play is characterized by a child's seemingly random movements and observations. You can see the figure here. It is the kind of play where you can observe a child's seemingly random movements and observations. So unoccupied play is seen in infants. Next question. Painful spasm of hamstring muscle and persistence to further extension of the leg at the knee while flexing the hip of a recumbent patient is option 1, Gurning sign, option 2, Brudzinski sign, option 3, opistotonus, and option 4 is angle clonus. The right answer here is option 1, Gurning sign. These two signs, Gurning sign and Brudzinski sign, is signs of meningitis. Gurning sign is patient supine with the hip flexed 90 degree, knee cannot be fully extended. You can see the figure here. This is Gurning sign, and Brudzinski sign is knuckle rigidity or neck rigidity. Passive flexion of neck causes flexion of both legs and thighs. For these two signs, Gurning's and Brudzinski signs are signs of meningitis. Next question. Shuffling gait is observed. Option 1, juvenile arthritis. Option 2, multiple myeloma. Option 3, pelvic inflammatory diseases. And option 4, Parkinsonism. The right answer here is option 4, Parkinsonism. A shuffling gait characterized by short, hurried steps with the feet barely leaving the ground is most associated with Parkinson's disease. Next question. Acid-fast bacilli are found positive in which of the following conditions? Option 1, tuberculosis and leprosy. Option 2, SARS and diphtheria. Option 3, tuberculosis. Option 4 is diphtheria. The right answer here is option 1, tuberculosis and leprosy. AP or acid-fast bacilli are found positive in which conditions are tuberculosis and leprosy. Next question. Which among the following is the treatment of leukemia? Option 1, radiation therapy. Option 2, ergotherapy. Option C, surgery. And option 4, chemotherapy. The right answer here is option 4, chemotherapy. You can see the main treatment for leukemia. The first one is chemotherapy, then radiation, bone marrow transplantation, biological or immunotherapy, targeted therapy, etc. is there. So the first priority is always chemotherapy. That's why this will be the first answer, first option. You have to select this choice. Next question. Which of the following hepatitis virus spread by fecal oral route? Option 1, hepatitis D. Option 2, hepatitis C. Option 3, hepatitis A. And option 4, hepatitis D. The right answer is option 3, hepatitis A. The types of hepatitis you can see. Hepatitis A is by fecal oral route. B, C and D is for similar kind of route. Percutaneous permeable blood-derived body fluid. So B, C, D all same category, and A and E is for fecal oral route. Last question of this session. A seborrheic crust over the scalp of a newborn is known as option 1, cradle cap, option 2, granuloma, option 3, Mongolian spots, and option 4, salmon patches. The right answer here is option 1, cradle cap. You can see the figure here. You can see the cradle cap. A seborrheic crusting of a newborn scalp is commonly known as cradle cap and also known as infantile seborrheic dermatitis. This is cradle cap. We are winding up this session now. We will continue with the more exam preparation videos. Thank you so much for watching this video. Please like, share and subscribe for more videos on this channel. Thank you so much.